everybody. It's Hank Linderman. It's a beautiful Tuesday here at Falls Rough. And if you're seeing what I'm seeing, you're seeing the beautiful view here. This is my backyard, and I thought I would share that with you. Mary Richardson is here. Mark Andes is here. Barbara Ticci is here. Bill McNichol is here. Cindy Braun is here. We got 13 people here already. Oh, my goodness. Everybody, please do us a favor and share. Oh, I love that sound. Let's do it again. Oh, I just adore that. Hi, everybody. I'm Hank Linderman. I'm running for Congress here in Kentucky's 2nd District. That's just south of Louisville on down to Bowling Green, Kentucky, and from Owensboro all the way across to Danville. We got a huge day. Chris Pritchard is here. Chris, haven't seen you for a long time, and we play this because we want you to share this. So please share this broadcast right now. And if you're really cool, Jerry Reed is here, I see. Jerry, glad you're here. Everybody, please share. That's how an angel gets their wings. That's the idea. Anyway. So we have a really big thing going on here because we've got 2 special guests appearing at the same time. This is the first time we've done it. Technologically daunting, but I think I'm up for it. I think I've worked out all the technical kinks. We will see. Let's look at the lake again. Doesn't that make you want to be in Kentucky? Makes me want to be in Kentucky. I just love it here. All right. So we have a couple of things to talk about. Maybe the first thing to talk about is I hope you all are, I do feel pretty happy. Roy Frazier is here. Jean is here from Garrett County. She's going to share. I know she will. Roy's going to share. I do seem happy. You know, I think because I didn't watch the Republican convention, but I did watch Stephen Colbert and his take on it. So I strongly suggest you don't have to have a subscription. You can see his preview of his response to the first night of the Republican campaign. It was a national. You know, one of the fascinating things about it to me, I don't know how you do this, but they decided not to have any platform this year. They basically said, oh, we're just going to rerun what we did in 2016. So they don't really have a platform. And I think that's very, very strange. And yeah, Barbara, you know what's good for you. Don't watch that thing that could give you, that could mess with you. Mark, maybe you watched it, but I'm just going to say to all of you.
Now wait just a damn minute.
Wait just a damn minute. You don't need to watch that crap. So glad you're here, though. So anyway, we've got Dr. Gregg.
Gregg Adams, good Dr. Adams. Ask Dr. Gregg.
He's going to be showing up also with John Winkelman. And John was on last week filling in for Dr. Gregg because he was filling in for Dr. Gregg, and he talked about Medicare fraud and other things. Well, I got these 2 guys introduced, and they've had a phone conversation, so I'm not exactly sure what we're going to talk about. We've got a little bit of work to do first, so I suppose we should focus on that. I've got to switch modes here. Give me a second. Oh, boy. You just need that deep cleansing breath every once in a while. Anyway, so here we're looking at the grim numbers again. A new milestone, 181,000 Americans dead because we as a nation failed. But we really didn't have any leadership that was worth a damn through this thing. You know, if we had only done as well as some other countries, maybe we should look at some other countries. Let's look at, I don't know. How about Germany? Look at Germany. Total amount of deaths, 10,000 people. And Germany's about a quarter of the United States, I believe. Is that right? I think they're around 86 million people. So instead of 180,000 dead, we would have less than 40,000 dead. What a big difference. Look at Canada. 9,000 dead also. They're a little bit smaller, so they didn't do quite so well, although they did really well in terms of their number of total cases. But the people that did get sick didn't do so well. Let's see what else we got. Do we have Kentucky? No, this is the states. We're looking at the at the top. Oh, I just got a shout out from Alexandra Thomas, who I knew. Well, Alex, let's not say how long ago it was. Anyway, she sent a contribution and got sent a nope button. You see the nope button. That means no plastics in my environment. And Barbara Ticci, I owe you a letter. Because you contribute on Venmo, I haven't caught up with you yet. So my apologies. But anyway, we're sending out nope buttons with the thank you cards when you write us a check or give us a nice contribution. That makes quite a difference. All right. Anyway, where was I? I'm easily distracted. Let's go back and look at this. Oh, so we're still looking at California is still the leader in terms of total cases, and they had the most amount of new deaths yesterday. We still are in a plateau. So this is, disheartening to say the least. Here's Kentucky, and yesterday 370 new cases, 4 new deaths. Tragic, of course, but we are struggling to control this virus. Now, Cindy, by the way, is mentioning the cell phone tracking video, and she's put a comment up there that you should look at. When the Sturgis motorcycle rally went on, there were people, 250,000 people, I think, maybe more, came from all over the country to gather and celebrate their motorcycle culture. And I've actually performed at Sturgis one year with the group America, which was tremendous fun. And the people were great. And I really enjoyed it. It was fun to do. But it was a party. It was a party. And they had a few beers and they had a nice time. But during a global pandemic, I'm not sure this was the wisest idea. Well, the cell phone data will terrify you because you'll see just how far this virus is going to spread. I unfortunately only have a picture of Dr. Gregg handy. Now, this is not the regular Dr. Gregg picture that we have. We normally have the other Dr. Gregg picture, but a close friend said it made her uncomfortable because Dr. Gregg was looking at a skeleton. So we've put Gregg Adams now in his work uniform. So let's call Dr. Gregg and then see if we can get him on the phone. And then I have to call again to get, let's see, how do we do this? Gregg Adams, FaceTime audio. Let's see if Dr. Gregg can get on.
Hi, Gregg here.
Dr. Gregg, how are you doing?
I'm doing wonderfully. Thank you very much. How are you?
That's a dangerous question is what I've taken to telling people, but somehow or another I'm hanging in there.
Good.
And it's always a pleasure to have you here. We really missed you last week, but you were on 12 days in a row of trauma care, or what were you doing?
A combination of lots of things. Trauma care, doing good old-fashioned general surgeon things, fixing hernias and taking gallbladders out, and doing clinics. But over the weekend, we hit new records for trauma care. Part of the problem is the state of California is on fire. And so we're taking care of people with smoke inhalation, and people are moving out of their houses and crashing cars. And so it's a very challenging time in the state of California.
And not far from you, I think Santa Cruz is aren't there Santa Cruz mountains on fire? And
yes, it's about 20 miles away.
Oh my gosh. Well, I have a friend who lives up there who the word is their house is safe, but they were evacuated. And the first hotel they went to, they got there long enough to get unpacked and relaxed, and they came and evacuated them from that hotel because the fire was
oh my
there.
Goodness.
So it was quite a thing. Let's call John Winkelman. And you guys talked earlier today, I believe, right?
We did. We had a nice chat.
I have to sneeze. Hang on.
Yeah,
Sorry about that. John Winkelman, are you there?
I am.
So glad to have you here. I cannot locate your picture, so everyone has to look at Dr. Gregg and only imagine what you look like.
They're safe this weekend. Okay, good.
Well, it's a very nice picture that I have of you. I just couldn't locate it in time, so I apologize. Now, you guys talked earlier today, and there's a list of things that maybe I'll put out there, and then I kind of want to turn you guys loose because I know how entertaining the two of you can be. One of them is the new treatment that President Trump has started to Trump. So I don't want to get in trouble. We need to play the sound each time we say his name. About plasma, he calls it. I think he means plasma. And so, Dr. Gregg, can you fill us in on that?
Yes, this is not a new treatment for either COVID or any disease that has potentially antibody responses. It's called acquired immunity. You take plasma from someone who has had the disease, and you give it to someone who has developed antibodies to the disease, and you give it to someone who is actively in the throes of the disease, hoping that the antibody will take the virus out of the bloodstream, and that's exactly what it does.
So this is potentially a good thing.
Yes, but you have to use it in the right timing. You have to apply it to people who you think are going to get very ill at a time when the virus is still present and circulating through the bloodstream.
Okay. So
people who get very, very sick are sick because of the immune response to the virus. The virus is no longer in the bloodstream, and it's at that point that the plasma treatment is way too late.
Well, it seems that President Trump is always looking for the silver bullet, the thing that's going to magically save us all, but that seems pretty unlikely.
I agree. I don't think that we're going to have it's a donation at a blood bank. Blood banks love when people come in and donate blood. The plasma is used in a variety of different ways. Sometimes it's just taking the platelets out. Sometimes it's just replacing blood clotting or other types of proteins. In this case, it's hoping that there's enough antibody present in the bloodstream that it's going to make a difference for someone's disease. But I don't think that this is going to be a panacea.
Okay. So just to get John into the conversation, I kind of want to, why don't you guys pick up where you were when you spoke earlier today? And
well, we solved healthcare today, so I think we're probably good, right, Dr. Gregg?
We did, and if you only send us $5 a week for the
we too can buy a yacht for the Mediterranean.
When we talked about what we talked about today was what are the barriers getting to a single payer system, and we came down to a very big and daunting set of barriers that were probably too big for us to solve in real time. And so we decided to start paring down our ideas and what is it that we can do in a short term to make small inroads towards making what is the goal, which is affordable healthcare available to as many people as possible.
Right. So Hank, essentially, I think Dr. Gregg convinced me that jumping to Medicare, to single payer universal health coverage immediately is probably going to run into too many additional barriers that already exist, but we're not going to overcome them by saying, yep, that's what we're going to do. And I've been, 40 plus years, I've been talking about universal health coverage, single payer. So that's a big leap for me to say, maybe we ought to step back now and look at really what the true barrier is. And it's money. I mean, it comes right back down to it. And you being a politician, you get lumped into the money in politics. And what does that mean? How do we overcome that? And how do people interpret? As you found out last week when we were talking, many of your constituents say, I don't want to pay for other people's care. It's my tax dollars. So what might we do differently to kind of identify how to change the system a little bit and, step by step? And, we were talking about the real impact of term limits and campaign finance reform as being hard to overcome. So let's take a small step. Former Vice President Biden wants to lower the Medicare age to 60. I believe in our conversation, Dr. Gregg and I were saying, well, if we make Medicare for All as an option, make sure that employers are including that as one of the healthcare coverages that employees can choose when they're choosing their healthcare every year. If Medicare is one of those, the costs are substantially lower for Medicare, and I have some good experience with that myself. the costs are substantially lower, all of a sudden that's an option, and we start to see let the citizens of the United States choose to move towards universal coverage by, oh wait, I can save $500, $600 a month on my healthcare costs just by going to Medicare. Maybe we move that way.
Well, first of all, didn't the House and the Senate plan, didn't they each talk about phasing in coverage with a Medicare for All system? So, for example, you would take the most vulnerable people and add them first. Current Medicare age is 65 and a fraction, I think. Does that sound right?
65.
Yes.
The month you turn 65 is when you can go on Medicare.
Okay. So the initial plan was to add everyone 18 and below who are already covered on their parents' plan, but but also people 55, and then the following year people 45, the third year 35, and then the final year the people that are least likely to get sick, which is the group above 25 years old, or 18 to 35 years old, are the group that's normally least likely to get sick. So that's a phase in over 4 years, but even that is too quick.
Well,
And that may be-
not so much as, go ahead, Doctor.
Go ahead, John.
Go ahead.
Oh, I was going to say that may be backwards. If we're going to phase in Medicare for all, Medicare is a way of paying for healthcare, but as it evolves, it's also going to be a way of defining what good healthcare is. And in my mind, it includes community programs to educate people about diabetes and taking their blood pressure medications. It's going to be working through political systems and business systems to say, let's decrease the fat in our foods and let's not have so many sugared drinks around. And if you start Medicare for all for a group of people where there isn't much chronic illness, but you can prevent chronic illness in the future, you're saving money over the long term, much more money than you would ever save by simply saying, all right, now we can take care of your high blood pressure because you're 45 years old.
That's a fascinating idea because, like I say, that's backwards from what the Bernie Sanders program suggested, but it makes sense because you get the most bang for your buck over the long term and also the least immediate hit to the system.
Right. And,
Exactly.
and what I was going to say in my part of this conversation is it too fast? Nothing's too fast as far as I'm concerned because I want to see universal coverage. But I think you still have the political and financial aspect of healthcare to overcome with that kind of plan. If you let the citizens of the United States, the employees and others choose to go on Medicare, then you get the decision is made by the populace. It's not made by politicians. So the
Right.
approach that Bernie Sanders is pushing is we're going to mandate that this happen versus opening it up and let it flow naturally. Because if you're saving that kind of money out of your pocket every single month, why would you not go to Medicare? You know how it covers your parents. Why would you not do that? You know how it covers your grandparents. Why would you not do that?
Absolutely.
And then you're getting the people who have been employed for 20, 30 years at the higher age groups that Dr. Gregg was just talking about. We'll see the benefit almost immediately, whereas the younger age groups that Bernie wants to start with won't because they don't get sick. And again, you're not getting that populist to say, how do we properly care for our citizens?
There's another political objection, which is some people like their insurance. And I can imagine, depending on where you are in your career and who you've been working for, if you've been working for a company for a number of decades and you've got a healthcare plan that you're satisfied with, I can imagine you would be concerned about disrupting that, especially if you're towards the end of your working career. But it seems that there's got to be some way to smooth that transition out or just grandfather certain people in to the same coverage. And
I'm not sure you even have to get rid of proprietary insurance companies. You'll have a choice through the panel of insurance options from your employer. If you would like to choose an insurance option where part of your healthcare dollar goes and buys a new yacht for the CEO of that insurance company, that's your choice. If you'd rather have more of your healthcare dollar take care of you, then choose the Medicare option.
I've always wanted my healthcare provider my healthcare insurance provider to have a yacht.
At least one, if not more.
Well, a personal submersible, I think, is really isn't that the gold standard now?
It is indeed.
I think they're only $500 million for the basic model. You have to add extras to that.
The one of the things that John and I talked about was the rent seeking, the pennies of the healthcare dollar that are taken out of the healthcare dollar as that dollar moves along the system, whether it's a CEO of an insurance company or the stockholders of that insurance company or the medical device R&D fund or the national meetings for the sales force of that medical device company. All of those are pennies that are taken away that do not end up in the pot that's available to purchase operations or vaccinations or preventative health models at the end of the road.
Right. Well, that raises another point as well. A question that got asked of me earlier today: how do we, if part of Medicare for All is getting the purchase of pharmaceuticals under control, and many other nations, the nation of France, for example, if you want to sell, prescriptive drugs in France, there's one customer, and that's the nation of France. I believe the same thing in England and also in Canada. If we adopt something like that, where, for example, Medicare is the single purchaser of all drugs, will this put American drug companies out of business?
Of course not. You still need new drugs. You still need to have new approaches to diseases. I think that research and development will continue. Drug companies think about what it costs to do studies. One of the ways that we can ease that cost is by decreasing some of the cost of doing those studies. The FDA may look at how they evaluate new drugs and say, these studies are all good, but maybe we can decrease the cost of them.
So, Dr. Gregg, is it also true that the same drug sold in the U.S. at $1,000, as just an example, only costs $100 in another country? It's the same drug. So it's
Absolutely.
the same pharmaceutical company, it's the same drug. So obviously they can sell it in the U.S. for the same price. There is no reason they can't, other than how much profit they want to make in the U.S.
That's exactly right.
And we see this a lot with meds that are off patent, that anyone could make, but they're down to one company making it. I think the famous example is the EpiPen that, a few years ago was $80 each, and a Wall Street whiz kid bought the company that made it and upped the price to $800. And because he had a corner on the market, was able to get away with that. Now, he did some other naughty things. I believe he's in federal prison for tax evasion and perhaps securities fraud. I can't. Martin Schrekel, is that his name? Schrekelly? Remember this guy?
Don't recall.
Oh, okay.
I remember the guy, but don't remember his name.
Right. All right. Well, okay. I think we've solved things pretty clearly. It does seem like prevention, of course, becomes a tremendous way that we can, you mentioned changing our diets, but medicine in the United States right now is not about prevention, is it?
No, it's not. The way when you think about what we can take care of, we tend to think about the diseases that we have treatments for. We take care of high blood pressure because we have a number of pills that we can use to treat high blood pressure. We have so pharmaceutical companies are not looking for patients. They're looking for, they're advertising. They're looking for buyers. Right. They want customers. We have ways of lowering blood pressure that don't have anything to do with pills, that have to do with exercise and changing your diet. But those are hard things for not just Americans, but human beings to do. It's easier to say, I give responsibility to this pill, rather than saying I have to get up an extra 15 minutes early to get on my stationary bike for 15 minutes. Right. We don't like that work.
Right. Which is a shame because, I think we're best if we minimize the amount of medicines that we take, that we minimize that sort of thing and maximize exercise. And we don't need that much exercise, is my guess. Something like 3 half-hour walks a week makes a massive difference in your health.
Yeah, absolutely. And Hank, I'd like to add that taking care of ourselves. That's our personal responsibility. We see how mask and anti-mask and vaccine and anti-vaccine respond to that. But from a healthcare perspective and maintaining health, keeping people healthy, to me, that's a data guy. I'm a data geek. To me, that's data. I mean, I've been analyzing data for 40-something years, specifically in an effort to try and say, how can we better take care of the patient? How do we take care of the family? One of the things that we did back in the 90s, for God's sakes, was the relationship of parents and children and asthma. How many lost days are there in work? What does the employer lose in lost productivity when the employee has to stay home and take care of a sick child? Well, if you do some proactive things to keep that child from having an asthma attack or any other kind of illness that keeps them home, then you're benefiting not just the patient, but you're also benefiting the employer. Those kinds of things. That's data-driven. That's all data-driven.
Right. Well, when our focus moves in this direction, I think there's so much benefit we could get from this. You know, that idea that we talked about very early on in this conversation was that people don't want to pay for someone else, even if it saves them money. They don't want to do that. And I don't know how to get over that one.
It's a matter of understanding how healthcare works. People don't want to pay for someone else, but they don't realize they are already paying for someone else.
Absolutely.
As John mentioned last week, every hospital has a law that they have to follow, which is if someone shows up in their emergency room, they have to be evaluated and stabilized. There is no way we can say, I'm sorry, you have no insurance, wait outside. We have to take care of the problem. We all pay for that. The fact that there is not a named tax that says this is where it's used for, we lose it in the shuffle. But we are already paying for it. And so it's so much cheaper to take care of someone's disease over the long term rather than having it become an emergency and then we have to pay for the emergency care.
And people who are here visiting as guests, if folks are visiting from Europe, if we're ever allowed to travel again, there's going to come a time when we have people here from Europe, and we should make it easy to care for them as well. I think the pandemic has taught us that we cannot have any sick people in the country during the time of pandemics, and we now understand we live in the time of pandemics. There are going to be more of them.
Sure. If you travel from Germany and you get into a car crash and come to my hospital, Germany's national healthcare system will pay for that hospitalization.
I hear stories like this from France, from England, from Canada, from New Zealand, and so on. Virtually every other developed nation, if you're there as a guest, they will take care of you. And in New Zealand, for example, they call it accidents, if you have an accident. But I spoke to someone who went there and just had a flare-up of her ongoing condition. She didn't explain what it was, and they treated her. It's just easier to just treat everybody. You don't want sick people in your country. So I hope that we will move that direction.
Yeah, Henry Kaiser had this right. Henry Kaiser, who built many, many ships for World War II, realized that he had better ships built if he kept the trained technicians who were building his ships healthy. So he created a health plan to keep his workers healthy. And once they were healthy, they made better ships. And that's where the Kaiser medical system came from, was Henry Kaiser realizing a workforce needs to be healthy to be an adequate workforce.
And that is the message, really, that I think in this time of inequality, I'm expanding it now a little bit, and I hope I'm not stepping on your sensibility here, but we have a very serious time of inequality here in the United States. And I think for the very, very, very wealthiest of us, there's a lot of fear, and they're building places that they live in that are behind high walls, and they've got staff, and they've arranged a hidey hole in New Zealand and a plane that's always, fueled up. And, look, your life will be better. If you're one of these mega wealthy people, your lives will be better if the rest of us are better educated, we're healthier, and we're a bit better off. Your life will be easier and it will be better. You won't have as many zeros in your bank account, but your quality of life will be higher.
And you won't see a repeat of the Russian Revolution.
Well, then there's that. All right. Well, thank you guys both. I really want to do this as often as you guys can deal with it. We'll talk about that. So everybody seems to enjoy it, and I certainly do. I think it's a wonderful conversation, and we should carry on with it. So thank you both for being here, and hopefully we can see you next week.
It's my pleasure. And John, thank you.
Yep. Thank you, Dr. Gregg.
All right. You guys take care, and I'm going to carry on for a few more minutes. That was just wonderful. I think that's great. Thank you all for being part of this conversation. We'll do more and more of these. I finally have figured out how to have two guests, which makes it, I think, even more exciting. We do have a guest tomorrow that I've been promising you for a while, and he had a conflict. So we're going to have the illustrious John McPhee from the Doobie Brothers. John is on the right, holding the guitar, the light-colored Martin guitar. That's me in the center, and Chris Martin, who is the leader of CF Martin Guitars. Martin is a quintessential American company. I think they've been in the United States since the early 1800s, and they've been a family-owned business, and I own Martin guitars. They're just wonderful instruments, and Chris Martin was a perfect gentleman to us and was wonderful to speak with. But John McPhee is going to be our guest tomorrow. Please get me some questions. And otherwise, we'll talk a little bit about the Doobie Brothers. But one of the things I know we will talk about is his band called Clover. And I would love for you, I didn't show a picture. I've got a stack of CDs in the other room that I'll show you. But John is just a first-class human being, and we're going to really enjoy speaking with him. Now, of course, we call this Getting Angry. And, of course, we also talk about how we need to go Godzilla on this virus. We've got to do it, folks. Yes, we're probably going to have to pay people to stay home. That's going to be the idea. It'll take 6 weeks, maybe a little bit more, but we can knock this virus down when we finally have some leadership. President Trump could today decide that we've got to get rid of this virus, but obviously he's not going to do that. He's not really going to be capable. Anyway, thank you all for being here. I'm getting ready to move on to the next 47 things I've got to do today. Thank you all for being here. When you're getting angry, use it to focus yourself. Use it to focus your determination so that we can do what we need to do this November. All right. You all take care.